Hello and welcome to the Empower LEP podcast. I am your host, Jana Parker. I'm a licensed educational psychologist. I'm a group practice owner, and I am a mentor and the owner of Empower LEP. Today, I am just really fired up. I'm fired up. It's the morning and I'm at home, so I'm sorry if my mic sounds a little bit different, but I don't have one. I'm just talking into my computer. But I am feeling inspired to do a solo episode, and it is going to be on our LEP scope of practice. So I hope you enjoy this episode as much as I am about to enjoy talking to myself. All right, here we go. Welcome to the Empower LEP podcast. I am doing another business related episode and solo. And I want to share inspiration first and gratitude for my mentorship group. I only get to see these people every other month because Meredith Gleason does the other every other month, but I love it. And last night's group was really inspiring to me. It fills my bucket. It makes me feel like I'm doing the right thing by sharing my knowledge and kind of, I don't know, like group training a group of inspired potential and practicing and working their way into being LEPs and being in the LEP world. So I love it. I want to thank my mentorship group, and I want to encourage others to join if you are so interested. We do a little topic, and last night's was scope of practice. So I'm just going to talk about that today on the podcast. And then we have a lot of time for Q&A and go through, whatever anybody has questions about. So thank you, everybody. And you inspire me to keep going. And one of the things that I shared, and I shared this on last podcast, is that I really am going to kind of lower the social media about the podcast and just put it out and rely on growing the audience. And the best way for me and you, the best way for you to help me do that is to leave a 5-star rating and review on Apple Podcasts, because then you can actually put your name and you can write something. On Spotify, you can't do that. So if you would do that on Apple, you'd be so kind. And I will choose every time I do a podcast a winner. I totally said that I was going to do that on the next podcast, and actually I haven't looked. So, okay, on the next podcast, I will absolutely choose another winner, but I did choose the first one. So, yeah, I'd love to give away mentorship opportunities. With me, you get an hour of my time. So please leave a 5-star rating and review. Tell a friend, listen in, give me your feedback. Email me at jana@empowerlep.com if you have any topics you want me to cover. If you want to share some feedback, I would love to have it. And this is going to be probably somewhat of a controversial episode. I'm just going to throw it out there. I'm going to share with you what I believe our scope of practice is, based on my 10 plus years of LEP experience doing this job and really reading and feeling very confident in my own understanding of our scope of practice. I know that there's a lot of kind of questions about what is our scope of practice as an LEP. And there's, I don't know, like maybe some controversy over what is or what is not within our scope. I think it's very clear. And I'm going to take you through what I believe our scope of practice is based on the California business, what's it called? California Business Code, California Business and Professions Code. And like, I'm going to talk about it. And I feel very confident. And what I told my mentorship group last night is, if something feels icky, it probably is. And if it feels in your gut like this maybe is questionable, then you really want to question whether or not you should do it. One of the most important, well, let's talk about what are the important things when you go into private practice. You don't have anybody backing you up anymore. You have to make all of the professional decisions yourself, both for your own ethics as a professional, and how it's going to be perceived and taken by the community that you're serving, by the other professionals who are observing what you're doing, or who may or may not want to work with you or refer to you. You know, it's your own ethics, it's the families. They could be unhappy with something that you do. They could take legal action. They could write a bad review. You have professionals who you work with who may get a bad taste in their mouth if they see that you've done something that may be outside of what they think your scope of practice is. So those are kind of the reasons, right? Ethically, what should we be doing? Yeah, and I also want to come from a place of, I think that educational psychologists are unique. We have an we have a perspective that other professionals in this field don't have. And I think that that is very special. And I think that we should really stay in our lane and hold true to who we are as trained school psychologists turned licensed educational psychologist. And we should represent ourselves ethically, professionally, and in a way that really capitalizes on the expertise that we have as school and educational psychologists who have the experience of working in schools, in the trenches. We have experience that other professionals who do assessment and evaluation don't have. And they have experience that we as educational psychologists don't have. So although clinical psychologists and neuropsychologists are doing a similar kind of evaluation, their focus may be different because they have not ever maybe worked in schools. Maybe they have, maybe they haven't, but school psychologists have a unique perspective. And I think we can really capitalize on that. I think that when parents call and hear about what we do versus maybe what another kind of a testing psychologist might do, might be different. And I think that is a good thing. I think people are going to go to different professionals based on what they want. And I think that our scope of practice is really around access to education, learning, the academic process, what is going to make them successful educationally. What we should not be doing are medical diagnoses or diagnostics outside of a psychoeducational lens. And I think that the codes for us and our scope of practice are pretty clear. So I'm going to take you through them, and just know that I'm really coming from a place of positivity about our profession and how we have to really hold true to who we are as professionals in this specific profession so that we don't dilute the field, and also so that you don't get in trouble. Okay. So let's talk a bit about the scope of practice for LEPs. So defined by the California Business and Professions Code, the statute specifies that the practice of educational psychology includes professional functions pertaining to academic learning processes or the educational system. And then it gives some examples, such as educational evaluation, diagnosis of psychological disorders related to academic learning processes, and then administration and interpretation of diagnostic tests related to academic ability, learning patterns, achievement, motivation, and personality factors, and providing psychological counseling for individuals, groups, and families. Okay. And then it also goes on to consultation with educators and parents, conducting psychoeducational assessments to identify special needs, developing treatment programs and strategies to address problems of adjustment, and coordinating intervention strategies for individual crises. These are all things that we do as school psychologists. And now we get to do it in private practice where we have fewer barriers. We can use and should use clinical diagnoses, and we have a broader range of recommendations that we can talk about because we have the ability to be more transparent. Now, everything that I read here describes something related to the academic or educational or learning process. Nowhere does it say you should be doing diagnostics with not related to the academic learning process. So to me, this is what this means. The evaluations that we do should always be related to academic learning, functioning, etc. If a parent came to me, this is how we do it in my practice. If a parent comes to us and says, I just want to know if my kid has ADHD, we say you could go a couple of routes. You could go to your doctor and just get a diagnosis of ADHD. They might do a rating scale with the family. Maybe they would do a rating scale at school. They would do an interview with you, and in 15 minutes, they might diagnose ADHD, maybe an hour. Now, you could say, as an educational psychologist, oh, well, I did that and I got a rating scale from school. Sure. Yeah, you got a rating scale from school. Are you, though, doing an evaluation that's really digging into how is this affecting a kid at school? Or are you doing an evaluation that says, well, I got some input from what the teacher observes from this kid at school? You could probably get away with that being within your scope of practice if you got a teacher rating scale. But to me, the reason that our evaluations stand out for ADHD is because we're looking at really what is the impact of that ADHD on their learning, and what can I, knowing what I know as an educational psychologist, recommend to support what's happening here. So we have a lot of pediatricians who send us the kids who they think might have ADHD, and parents are concerned about ADHD, but the pediatricians don't have a ton of time to do a real in-depth evaluation. And they're making a really big decision as to whether or not they're going to put this kid on medication, or maybe that's going to be a recommendation of theirs. So they refer to us because they know that we are going to do a much more comprehensive look at what's actually going on. And maybe we come up with ADHD. Maybe we also come up with a learning disability. Maybe they're having trouble paying attention because they're having trouble with reading, right? So, or maybe they, there are so many different things that you glean from a psychoeducational evaluation or a school neuropsychological evaluation. They're going to give you the information that's going to help you really understand from multiple perspectives what's going on for this kid. And what I always say to parents when they call is, look, if I'm only looking for ADHD, I don't know what else is going on. And it could be other things going on. Now, do you want to take the risk and be like, yep, this is ADHD. I'm going to put my kid on medication. Maybe it is not ADHD. If we don't rule out other things, then we're not only looking at the problem, we're not looking at what other problems there could be, and we're not looking at their strengths. So this couldn't possibly be a strength-based evaluation because we're only looking at deficits. So we should not be doing a diagnostic evaluation only for ADHD outside of how we are looking at it in a more comprehensive way related to their education in whatever way that is. So now, again, this is like a bit nebulous, right? So this can be interpreted, I think, in several different ways. But when I see diagnosis of psychological disorders related to academic learning processes right there in our California Business and Professions Code, that to me says, I need to be relating this to that. Now, you could do it as little as you want to or as much as you want to, but for me, in my practice with my clinicians, I am always going to do what I feel is right in my gut, in my heart, in my head. I want us to take a bigger look. And I think that is an incredible selling point. And yes, it might be more expensive, but that is because we are taking a deep dive look at their child. And usually parents are like, yes, actually, I really do want to know if this is ADHD and if there's anything else going on, right? So I find it to be of benefit, and I think we sell it as such. And so I mean, we have enough business, so I'm not worried about it. And I feel good about what we're doing. Let's talk a bit about, I want to talk a bit about autism because this one has come up. And so let's talk first about maybe what you shouldn't be doing more of, like as an LEP, and then autism, because it's come up in Facebook groups. People are talking about it, and I think there are a lot of different opinions about it, and I'm going to give you mine. So, what you should not be doing as an LEP is diagnosing or treating severe mental health disorders unrelated to education. You should not be providing non-educational therapy. So, like couples therapy or like ongoing individual therapy for anxiety or something with an adult, say, or providing medical recommendations like a doctor would. We're not prescribing, we're not advising on specific kinds of medications. We're just maybe saying, you should talk to your medical professional about medication. We shouldn't be providing psychiatric services. Okay, so what does this look like in terms of autism? When LEPs do an autism evaluation, it should be really similar to what we're doing when we're looking at autism in schools. So we can assess for autism if the purpose of the evaluation is to determine how the children's characteristics impact their educational performance, their social emotional functioning, or their ability to access the curriculum. We're not diagnosing a medical condition, rather we are determining if the diagnostic profile aligns with educational or functional concerns. So don't take this to mean you cannot diagnose autism. We absolutely can diagnose autism, but we're diagnosing it as we are looking at the impact of these characteristics on their functioning educationally. So we should be avoiding a medical diagnosis only. So LEPs cannot independently provide formal DSM-5-TR diagnoses of autism unless we hold an additional license if that diagnosis is only for the purpose of a medical need. Okay, so let me talk about this a little bit more. When a family needs a medical or clinical autism diagnosis for the purpose of getting insurance to cover different therapies like ABA, they have to have a very specific kind of evaluation done. If you have ever seen one of these, it requires the ADOS. It requires a cognitive screener. It requires an adaptive measure and a very comprehensive in-depth developmental interview. Now, all of those 4 factors also have to be provided by a licensed psychologist, so a child psychologist who has a psychology license, not licensed educational psychologist, licensed psychologist, neuropsychologist, or a medical doctor. Those are what the insurance companies are looking for as they allow for families to get ABA and other services for their kids. So that's a different kind of referral question, and it's a different kind of evaluation. So I really want to be clear here. I am not saying that LEPs can't diagnose autism. I diagnose autism. I diagnose it without the ADOS. I'm sure most of you at schools will say, the characteristics of autism are clear without doing an ADOS, right? But when someone's coming to you in private practice and they just say, I need to know if my kid has autism, like let's say it's a 3-year-old, or let's say it's an adult who wants to know if they have autism. I don't know. To me, in my gut, that feels icky. I am not just diagnosing autism. I am looking at autism characteristics in relation to how they impact a person at school. And I know that we could also say like, oh, well, maybe it's impacting them at work. Yes, maybe it is impacting them at work. But if this is an adult who has never been diagnosed with autism before, I think, I mean, we're licensed educational psychologists. We are not clinical psychologists. And our training has been with kids. So I feel like if a 37-year-old male came, called our clinic and said, I think I might have autism, I would refer out. Some people might feel very comfortable doing that. That person's probably not going to need ABA therapy, right? I think you have to take these cases one by one, but if someone is coming, and make a decision based on your comfort level, your areas of expertise, and how it feels to you. I would absolutely refer out the 3-year-old whose parents want to know if they have autism, or I would give it to my clinical psychologist on staff. As educational psychologists, if that family of a 3-year-old comes to you and says, I think my kid has autism, and it's just like too long of a wait to do at Kaiser, but we need an evaluation, I would not have one of my educational psychologists do it. I would have my licensed clinical psychologist do it. So I really think that we have to, the reason that I'm bringing this up is because it's important for people to get what they need with what we provide for them or what someone else does. So for example, if a family really needed ABA therapy and I did the ADOS, I did all of those, I did the cognitive screener, I did the adaptive, and I wrote up and I did an ADIR, okay? Or a MIGDAS, and I did all of that, and I, said, yep, they have autism. And then the insurance company went, well, wait, they're not a licensed psychologist. No, I'm not. So what happens then? Okay, so maybe I go, okay, well, I can just talk with the kid's pediatrician. I've thought about this before. I can just talk with the kid's pediatrician and then the doctor can diagnose them with autism. Yes, maybe they can. But having to take that extra step, what do you think that family is going to think of you? Do you think that they are going to maybe question your professionalism, your ethics? Maybe, because now they're like, oh, why do we have to take this extra step? Right? And maybe that doesn't happen, but maybe it does. Maybe the insurance company doesn't realize it. Maybe they do. But like, guess what? If you have an MPI number, they're going to look at the report and your license, and the insurance companies want nothing more than to not pay for people to get things, right? So to be on the up and up, a licensed psychologist should have been doing that in the first place. So if you make that parent second guess the work that you did, then maybe it leaves a bad taste in their mouth. Maybe they tell their friends about it. Maybe they tell the doctor about it. Maybe they tell their therapist about it. Maybe they tell their speech pathologist about it. And then there you are, like, oh yeah, I just did something that was really kind of outside of my scope of practice. So these are just things that you want to think about. Now, again, there's some, I don't know, flexibility here. These are not, these guidelines that we have are not hard and fast. They can be interpreted in different ways. I am telling you how I interpret them, and you can do what you want. But I feel very confident about when we take a case and when we refer out. And I go back to our scope of practice as LEPs. The only time that we do a partial assessment of, say, ADHD is if a kid has already been diagnosed with, say, they've already been assessed, they already have maybe a diagnosis of dyslexia, and now parents want to know if they also have ADHD. Well, guess what? Yes, maybe we may do a smaller version of a comprehensive evaluation, but we are still looking at how that ADHD impacts their education and also how their dyslexia might tie into it. Okay. We might also be doing it the other way around. Like they've been diagnosed with ADHD and we now are doing a smaller scale dyslexia evaluation because we already have information. Okay. Or maybe it's somebody who's been assessed several times and they just need a like kind of refresher or like a triennial kind of thing. So then we might do a lesser, but we're still always doing a comprehensive look at the whole picture, even if some of it has maybe already been done for us, but we're talking about that. We are not just doing diagnostics without looking at the impact to education. Now, am I saying you have to do like an entire Wyatt or whatever? No, I'm not necessarily saying that, but I am saying that you need to look at it in relation to the academic learning processes like our codes tell us we should be. And just refer out when you feel unsure. If you feel unsure about your own skill set or the ethics behind the decisions that you're making, then that should tell you something. And so now I want to talk a little bit about what happens if someone is unhappy or somebody reports you. I kind of went into that just a moment ago, talking about how maybe you leave a bad taste in a parent's mouth. Your reputation and your professional impact are so incredibly important because, again, you don't have a school district backing you up. You are responsible for you. You're responsible for your company. You're responsible for the other people who work for you. That always has to be at the forefront is your reputation. You don't want families or other professionals questioning your professionalism and what you do. It's another reason why I find Facebook to be kind of a scary place, right? Like we don't want to misrepresent ourselves. I think that the testing psychologist community as a whole, whether you're a clinical psychologist, a neuropsychologist, an educational psychologist, it's growing. And there are a lot more people talking. And we all have kind of a different scope. And it's interesting to read, how different people respond to different questions and things that people talk about on Facebook. But I also think that we have to represent ourselves as educational psychologists to the testing psychologist community as a whole as really who we are, or else we are going to dilute who we are. And people could look at us like, who are these educational psychologist people? What do they know? They don't have a doctorate. I mean, some of us do, but like they could say they don't have a doctorate or they're not a licensed psychologist. That is true, unless we are, right? And if you are, then that's not what I'm talking about here. So if you are not a licensed psychologist, then there are certain things that you should or should not be doing within your scope of practice. Okay, so what happens if someone is unhappy or reports you? So first, you would be investigated by the BBS. What does that look like? Well, I'm imagining that it would be a group of BBS people on the board, at a board meeting, sitting around and talking about the circumstances. And they're going to evaluate whether or not your actions were consistent with the LEP scope of practice, right? A family complains, they complain to the BBS, they file a report, and then the BBS has to decide whether or not your actions were consistent with your scope of practice. If they find that you violated your scope, you could face disciplinary actions. That could be a reprimand, fines, probation, suspension, or even just complete revocation of your license. Nobody wants to go through that process. So that's what happens on the BBS side. Now, if you're being sued by this family, because maybe it's just a complaint, but maybe somebody is suing you, which people in California are sue happy. Okay, so maybe someone's suing you for damages. So that's when your professional liability insurance would kick in. right? They're going to step in to defend you, but they are also going to assess whether the actions fall under the coverage provided by your policy. And if they determine that you acted outside of your scope, then they might deny you coverage. And that would leave you personally responsible for legal defense costs and or damages. So again, you've got the BBS who could take away your license or reprimand you. You've got your professional liability who could say, nope, this was not within your scope of practice and we're not going to cover you for this, because insurance companies don't want to cover you if they don't have to. They're going to find a loophole. You could also have legal consequences. So you could be found liable for damages. You could be ordered to pay damages. You could be paying your client's legal fees, and you could be paying compensation to the client. And then again, like, what does that look like for you? Right now, you have a ding on your BBS record. The parent doesn't feel good about you. They've complained to their parent groups. They've maybe left you a bad review. And the professionals they've also told the other professionals that they're working with. And then how did those people feel about you? So these are just really things to think about. I, again, think that the codes are pretty clear, and I interpret that in a way that I run my practice. I feel very good about it. I don't feel like I need clarification on what my scope of practice is, and we just stay within those lines. One thing I do want to talk about a little bit is how you get clinical training to feel like you do have something within your scope of practice, because making that shift from being a school psychologist to working potentially in private practice with private clients who are privately paying you for diagnostics that are not from Ed Code, right? They're from DSM. How do you get that training, and how do you feel confident taking a case? Because different cases are going to come your way, and some you may feel very good about and some you may not. And so, I mean, I was just talking about this last night. Like, we have had cases where because I support all of my staff. And we have had cases where I don't feel the most confident in supporting them on a case because it's not totally in my wheelhouse. So I refer and pay other people to consult with my psychologist when that is the case. I think it's incredibly important that we consult with others so you learn from other people, even if that means paying them for their time. Like, I do individual mentorship, I do this all the time. People come to me with their case consultation and report writing, and we go through it like I would with my own staff. That's incredibly important if you are on your own, if you're trying to do this all by yourself. Now, if you work for a company, that's another place that you can get training, right? So I work and train all of my clinicians. I read their reports every single time until they feel more confident and I feel more confident in them. But this is a journey. It's a learning process. It's like, you're used to having psych meetings and getting to case kids. And if you don't get to do that because you're in private practice and you're all by yourself, then you're missing that whole piece. I think there are trainings, there are workshops, there are different certifications you can do for different things. There's consultation groups. But I do think it's important to not just say all of a sudden, oh, I did one evaluation in giftedness, let's say, and now I specialize in giftedness. No, you don't. Like, what do you need to do? Like, you really need to think about, what is the point that you need to get to where you feel like you have enough under your belt? And I think that when you're there. And I think we have to look inside ourselves. We have to be very honest with the training that we have. We have to go out and continue to get more professional development and training when we don't have it. And only when we feel very confident and we've done a lot of work in a particular area do we really call ourselves an expert. We are educational psychologists. We should stay within our lane. We should be working within our scope of educational psychology. And again, I think it's pretty clear what that is. And I will just go back to, again, if your gut tells you it's out of your scope, it probably is. And I do not think that we have to be desperate. I think that the work is going to come to us. because people are looking for this expertise that we have. We just have to figure out how we are going to share that with the world and with the community so that it's very clear what we do. And I think we have to really uphold this profession of educational psychology so that we don't dilute it and people look to us as experts in this field. We are not clinical psychologists unless you are. We are not neuropsychologists, again, unless you are, because you might be. But we are educational psychologists, and I think that it stands on its own. And I feel very proud to be one. I feel very proud to be like a kind of helping to guide this field. And I would love to hear your feedback. So I'm going to end this podcast here. But I'd love any feedback. You can email me at jana@empowerlep.com. Again, I would love to have you in mentorship. So you can certainly come into those groups, or you can sign up with me individually and we can talk more about whatever your needs are. And please, again, leave a 5-star rating and review, tell a friend. Yeah, I just really want to make this a meaningful resource for you. So if you have other things that you want me to talk about, I'm happy to. I'll see y'all soon. This episode is brought to you by Empower LEP, the #1 resource for aspiring and practicing LEPs with courses, trainings, and mentorship opportunities. The mentorship program is amazing. We have monthly live mentoring calls with me, Jana Parker, or with Meredith Gleason. We give a mini lesson. We have people vote on what they want to talk about. So we give that mini lesson. Then we open it up for group questions and discussions. We have this amazing community of like-minded LEPs. We're at all levels of practice. We come together, ask questions, learn from each other, all the things. So the mentorship is really perfect if you are struggling to navigate running a practice, if you feel isolated, if you're seeking professional support and community, if you just want to enhance your clinical and your report writing skills, maybe you feel stuck, maybe you feel like you're not sure of your next steps, maybe you want some accountability, all the things. Meredith and I, we have done it. We are doing it. We are living this LEP life day in and day out. So sign up for a month or get a discount for signing up for 3 months, whatever you want, whatever works for you. Go to empowerlep.com/mentorship-program for more information. Thank you for listening to the Empower LEP podcast. Episodes can be found at empowerlep.com. If you liked what you heard, please leave a 5-star rating and review on your favorite podcast player. If you'd like to be a guest on the show, or if you have any questions for me, don't hesitate to connect. I would love to learn more. I can be found at jana@empowerlep.com.